Hello, everyone. I'm Dr. Ioanna
I am Dr. Vilma Pacheco-Barcia, and this is Open Doors Podcast, two women scientists driven by curiosity, evidence, and compassion.
Hi, everyone, and welcome back to Open Doors, the podcast where we explore professional well-being in oncology and beyond, one conversation at a time. Today, we are diving into a really important episode that speaks to all oncologists, trainees, consultants alike. We're thrilled to be joined by Dr. Jenny Liu, a medical oncologist, researcher, and one of the leads of a national mentorship initiative in Australia.
That's right. Welcome, Dr. Liu. She is a medical oncologist, translational lead, and early drug development at the Kinghorn Cancer Centre, St. Vincent's Hospital in Sydney, Australia. Co-joint senior lecturer, and not only co-leads a national oncology mentorship program, but her work has also led to a formal burnout statement and powerful data from the recent paper evaluating systemic burnout in a medical oncology through a national oncology mentorship program.
We will talk about how mentorship programs can protect against burnout, which is a really, really hot topic and a real issue across the globe, how to build resilience, and what the Australian experience can teach the global oncology community.
Dr. Liu, welcome to Open Doors Podcast.
Thank you so much, Ioanna and Vilma, for having me. It's great to be here and wonderful to see the work that you're doing in the mentorship and resilience space.
You've mentioned before that mentorship was pivotal in your career, Jenny. Can you tell us about your personal journey and how that inspired you to help to launch a mentorship initiative?
Absolutely. So my career, I guess, has been a little bit different to most oncologists and trainees. I actually did a PhD very early in my career as a medical student when I got an opportunity to do a research project in bowel cancer and lab-based work, and I loved it so much I decided to defer my medical training to do a PhD, a bit like the US MD PhD program. That gave me wonderful opportunities, but did mean I was at university for 9 years. So really the entire 20s was spent sort of in the lab, very long hours, and 2 years into my PhD, I did suffer burnout myself. I guess there was a lot of stress about whether experiments would be working out. And I think in that time, I realized the value of having mentors and having hobbies outside of medicine to sort of divert some of those stresses. And that's really when I got on the mentorship bandwagon. After finishing my training and then during the specialty training in Australia, there was actually a crisis point where unfortunately 4 of my peers who were physician trainees at the time committed suicide within a really short time frame. And this didn't occur within one hospital necessarily, but really highlighted to our country the critical issue of burnout and stress for trainees that were going through their training, juggling lots of things on top of their work and their study. And as part of the response to this, a formal mentorship program was set up for trainee physicians, and I was fortunate to be one of the first cohort of trainees to benefit from that. So again, mentorship came back and helped my cohort get through that difficult time. And then we wind forward to, the COVID pandemic, and shortly after COVID, we really, as part of the education leadership program within New South Wales, we were helping our oncology trainees through the learning during COVID isolation. And there was a lot of education programs, but nothing really identifying the underlying issues regarding workload, workforce planning, job uncertainty, and, burnout again. And so that's when, with some colleagues, including Dr. Udit Nindra, together we launched the mentorship program, initially in New South Wales and then more broadly in Australia.
Wow, Jenny, that experience was very difficult, but it is true that the connection to personal experience is very powerful. So, from that personal experience, you helped upset a mentorship program, first in New South Wales and now nationally?
Yes, that's right. So the first pilot was in the state of New South Wales in 2022. And in that year, we had 40 participants, so 20 trainees and 20 consultants. And we really found that burnout rates were quite high, and all pairs that were matched that year found that relationship to be very helpful. And because of the very promising pilot, we were able to then expand that the following year in 2023 into the inaugural national program, which we call NOMP 23, the National Oncology Mentorship Program.
That's amazing, Jenny, and it is the data you shared and the personal story is a massive concern because we are too reactive. We do things, but we do that following a tragedy, as you confessed. And mentorship is still seen as optional, frequently a luxury to have. But as your data show, it is indeed a necessity. It can play a central role in addressing burnout, enhancing professional fulfillment, and fostering resilience and guarantee longevity in our profession, isn't it? This isn't just a point of view. Studies show mentorship improves job satisfaction, academic productivity, and even retention in healthcare professions.
Actually, Joanna, it is true that mentoring is a widely regarded as a cornerstone of academic medicine, supporting career development, research productivity, and personal growth. Yet, despite its perceived importance, a systematic review by Sam Munyak and collaborators found that mentorship remains inconsistently accessed, particularly among women, and that existing evidence base is limited by small-scale self-reported studies. So, Jenny, what you're presenting us today is very important and very unique because it highlights the urgent need for more rigorous, context-aware research to guide evidence-based mentoring practices in medicine.
Let's talk numbers. I like numbers. So, Jenny, your recent study that was published data that have been eye-opening. Can you talk us through the key findings of that study? You surveyed over 100 oncology professionals across Australia, isn't it? What stood out and what surprised you?
Yeah, so we surveyed all the participants of NOMP 2023 at baseline, so prior to the commencement of the program, and that was published in JCO Oncology Practice. So there was 56 mentees and 56 mentors, and strikingly at baseline, 77% of mentors and 82% of mentees reported burnout on the validated Maslach burnout index. Even more shocking was that only 5% reported professional fulfillment, and there were some concerning rates of, anxiety, 32% of trainees, and depression, 16% on screening questionnaires. So certainly there was a lot of concern about the well-being of the cohort, and this is the subset of people who had opted to participate in a mentorship program, and I suspect those that didn't or wouldn't have the capacity to may, score even higher on those scores.
It's so important that your program doesn't just connect people, but it tracks the outcomes. And it aligns what the literature has found. A large United States study by Shanafel and collaborators found burnout in over 40% of physicians, with oncologists reporting among the highest levels.
That's deeply concerning. What do you think is fueling these numbers in oncology specifically, Jenny?
Yeah, I think it's really multifactorial. And when we surveyed the participants, some of the recurring themes that came out included issues including the administrative load, the paperwork associated with administering treatment, booking patients in for follow-up, and I guess good things about oncology, the fact that our drugs are working better, patients are living longer, and there's increasing survivorship, but then increasingly complex survivorship and supportive care needs does mean that the system also needs to adjust from a workforce point of view in order to keep up with the demands. I think there are also aspects in terms of job security and related to the workload, time off, time to exercise, see family, friends, etc. And for some of the trainees, some concerns about supervision and oversight and lack of support from the local college were also identified.
Let's talk solution. Your paper highlights mentorship as a key intervention. What do you think, Jenny, makes it effective?
I think mentorship really brings in an opportunity for our trainees to network and debrief with someone outside their institution. So how we designed the program was that individuals were matched based upon areas that they were interested in from a career point of view, but also outside their immediate workforce, so that they felt there was an opportunity for them to debrief in a confidential manner. And I think that opportunity for connection to talk about some of the concerns that they're facing and get ideas and insights from someone who's been through that path was really helpful. And I've personally participated in that program as a mentor myself. And I even found being a mentor the reciprocal benefits of being able to reflect on where I've come, step outside of the immediate grind of the clinical workload and reflect on what I have learnt and hoping to pass that on to peers. I found that deeply rewarding as well.
That's amazing, Jenny. And there's a clear link, the way you beautifully crafted your answer between mentorship and building resilience, isn't it? And what you shared reminds me of a review by West, published in 2018, that emphasized the value of connection, purpose, the big why behind why we are there, why we do this job. It's autonomy as antidotes to burnout. And mentorship seems to reinforce all three.
Fully agree. It's amazing, Jenny. And do you think formal mentorship should be embedded into oncology training programs?
Yes, absolutely. I think if there's certainly resources from a oncology program or a training college perspective, that would be really helpful, as I think we need to teach specialists not only the content knowledge expertise, but also how to juggle the challenges relating to the work we do, and also some of those softer skills like conflict resolution, communication, leadership and negotiation are some of the stresses that relate to the way that we are looking after our cancer patients and other aspects of research and education. So I think a mentorship program would be great, and very fortunate in Australia that the Medical Oncology Group of Australia has embraced and endorsed our program and is supporting the running of this moving forward. So how we managed to tee this up with minimal funding is that we align the start and end of the program with the annual MOGA meeting so that mentees and mentors can be matched and then they can meet at the meeting, and we provided space. And this year actually going to introduce lanyards for trainees and consultants to have, I'm open to be a mentor, I'm open to be a mentee, and they can sort of scan each other's lanyards and QR codes and match that way. Still brainstorming ideas, but I understand ESMO, ASCO also have similar programs.
And I should add, RCR, Royal College of Radiologists, have got a similar program as well, and I'm one of the mentors there. Mentorship certainly is not a one size fits all experience, and it can take different forms and shapes depending on career stage, and a number of other factors. And I'll touch on that again later. What does mentorship look like across oncology, clinical, research, academic, and is there a value that encompasses all three?
Yeah, I think there's definitely some overlap, and there are a number of programs out there. As an example, I'm actually part of one called Franklin Women's Mentorship and Leadership Program that's run through some academics who, similarly found problems with resilience and burnout, particularly facing women in the science and academia space. And participants in that program come from all different backgrounds, not just clinical and not just oncology. And that program's actually matched myself as a mentee with a very senior clinician researcher who's an intensive care specialist. Who I've never met before, but we're finding so many similarities. I'm learning a lot from that program.
Access to mentorship, Jenny, can sometimes feel like a privilege reserved for those who are already in the right circles. I remember when I was a trainee, it was my last year. I had my dinner, like my farewell dinner, and I had to write some notes. I did my PhD during my training years. As long as I remember, I've always been interested in pancreatic cancer and nutrition and cancer. It's the areas I'm mostly highly dedicated to. When I was writing my notes for my farewell, I remember I got so emotional because I remembered my mentor. Now she has retired, but we spent so many years together. And when I had to write a few words for her, I remember myself like I had so many tears in my eyes because I literally wrote, I really like investigating and studying and being with pancreatic cancer patients and helping them. And I don't know if this is because I was meant to like it, or if it is because how well you've taught me during these 5 years. And it's true that it gets me emotional still. I talk to her a lot. Actually, I talked to her a few days ago, and every time I talk to her, I take 5 minutes to remind her the print she left in me every time I am in my consult, every time I have a face a problem. I remember all that she taught me. So, what I want to say is that mentors really leave a print in us, but when you talk to other colleagues, sometimes they believe mentorship is essential for professional growth and well-being, but not all of them find that mentor in their daily routines. So I want to ask you, Jenny, what steps can institutions take to ensure mentorship is not just available to the well-connected, but to everyone?
Yeah, I think that's a really good point, Wilma, and I think it's about setting up the culture for openness and for that positive, feedback. I think not all institutions need to have a formal, like sit down mentorship program that has a start and an end, but really it can be embedded through the leadership and through individuals, because sometimes these relationships occur and evolve quite naturally. As trainees go through different rotations and they get to work with different specialists, I think if we all role model an openness of wanting to find out who the trainees are beyond, what experience they have clinically, but who they are as a person, what their dreams are, what their challenges they're going through, I think then there's that opportunity to nurture our trainees through mentorship, be it formal or informal. Of course, if resources are available and having a formal program is possible, then I think in the data really shows that having a program like this pays well in advance, because it provides our trainees the opportunity to recover from setbacks, to develop resilience and reduce you know turnover and other adverse outcomes. Like in our NOMP program, we showed at the end of the program, professional fulfilment actually increased significantly, and rates of burnout also was lower at the end. Whether or not it was directly due to the program or due to other factors, we weren't able to directly demonstrate that causal relationship, but the data at the end of the program was certainly very, very positive.
That's great. And we mentioned a number of occasions trainees. But another area I would like to clarify, Jenny, is who needs a mentor? So is a mentor only needed at the early stages of one's career, uh, as a medical student or as a younger consultant or a younger academic? Any thoughts on this?
I think personally I might be a little bit biased, that there's benefits at all stages of one's career. And I know some very senior colleagues of mine who really are leaders in their own right, who still seek, mentors to help them navigate perhaps some more challenging leadership roles, or if they have high ambitions to do practice changing global trials, etc. I think really there's a way that, at any stage of our career, that we can derive benefit from mentorship.
This is excellent. Any key qualities a mentor should have, Jenny?
Yes, I think being a listener, a good listener, to be able to understand the person they're working with. There are some differences, I think, between being a coach and being a mentor, where I think as a coach, you really are having a role of helping someone develop a specific skill set. But I think mentorship is really helping your mentee become a better version of themselves, which might not mean becoming better, learning it directly from the mentor's specific experiences or skills, but helping them reflect. So, listening and having that ability to communicate with openness and trust is really important.
I completely agree. Is there any training, formal training or informal training for mentors, Jenny, as part of the program?
Yes, that's a really good point. So, unfortunately, Owen, at the moment, we don't have a lot of resources within the NOMP program. So, while there is some orientation materials that some of us deliver as the kickoff of the program, we don't have a in-depth training program. When I'm part of the Franklin Women's program, though, I'm seeing a lot of additional resources, and that is a program that's been running now for 10 years. And well-resourced that our institution fortunately invests in to support individuals who are participating. So one of my goals in the future is to see if we can leverage some additional support to build in more formal training for our participants.
That's great, Jenny. And feedback is so important also. A mentorship relationship is dual. You learn with constructive feedback, which works both ways for mentors and for mentees. How do you offer feedback and how do you encourage your mentees to offer feedback to you?
Yes, I think feedback is quite important and it's a two-way street. So even in my clinical job, like today, I had a sit-down coffee with one of my fellows and welcoming, advice and input on how the clinical term was for them. Certainly everyone's a little bit different and there are a lot of competing challenges in terms of time management and balancing administrative load with clinical workload, meetings, and research projects. So it's always, I think, important to see how we can make that experience better for our trainees, what we can be doing differently. And then also, likewise, then being able to give feedback in terms of how they can be, growing or changing or learning to maximize the time and the experience in the term. And I think likewise, feedback can be considered also from a program point of view. At the end of NOMP every year, we also give all the participants opportunity to give us feedback about how they found the program. Would they do it again? Would they recommend it to their peers? And what could make the program better? I think certainly more resources and being able to bring people together face to face would be ideal because Australia is very geographically spread out, and sometimes our trainees are in regional sites or they move around throughout the year. So meeting their mentors face to face isn't always possible, but I think that's something we can also improve on.
Let's zoom in on the National Oncology Mentorship Program, Jenny. What did implementation look like at scale? How did you do it?
Yeah, so I think starting smaller and then expanding it out once we had done the pilot was important. There was a team of us, so we leveraged upon the expertise of some of the people who set up the mentorship program within the physicians training program that I spoke about earlier. And so having a team to help run it and with the support of the MOGA executive was important. Data, I think, is also quite critical. And for the pilot program New South Wales, we unfortunately didn't get ethics, so we weren't able to publish on our experience. But then we quickly learnt, needed to, consent our participants, collect data, ensure it's de-identified, and then use that data to build momentum and support from the college and beyond. And finally, I guess institutional support and backing would be ideal to ensure that this is sustainable in the longer term.
Wow, Jenny, that's huge. And what has the Australian oncology community learned from the program? What advice would you give to others trying to build similar programs?
I think having champions that are very passionate about this topic and the buy-in of different, stakeholders, mentees, mentors, and the fact that we're now getting some interest from our colleagues within hematology, palliative care, etc., is really quite promising. But I think also we need to recognize, I think mentorship isn't the only solution in the toolkit. There are huge issues in terms of workload and workforce. So at the moment, MOGA is actually in the process of setting up a committee to look at how can we track the changes in workload and how can we lobby, I guess, government and other agencies to be able to create more positions to support, areas where really it's really understaffed and patient needs are very high.
You've done an amazing job.
Thank
And
you.
given your experience and the success, what would you say to institutions that still view mentorship as a soft initiative?
I think in those institutions, it may be driven by certain individuals. I think they're perhaps looking at, budgetary, financial constraints and showing them the numbers and the benefit from individuals and the issues with turnover and the cost that has, as well as clinical mistakes. And the cost of that on the institution is quite important. There's been other initiatives where if there are people within executive, getting them to spend some time with us as clinicians on the ground, seeing what we are seeing in the clinics with the extent of the workload, the paperwork, and seeing how we can essentially remove pebbles in the shoe, so to speak, to be able to make the working day a little bit easier. And then, investing in programs that build on the well-being of people within the institution, I think, is important.
Thank you, Jenny, for sharing all your insights on the mentorship program. Before we close, we always like to end with a quick reflection round, rapid fire answers, and big insights.
So, what is a quote that keeps you going?
So I think my favorite quote at the moment is really hoping for the best and planning for the rest. So I do that a lot when I talk to patients. So I run early phase clinical trials. Part of early phase trials really is about hope, because if we don't have any hope that these trials will work, then why run them in the first place? But there's a huge degree of uncertainty about the benefit of trial participation. And likewise with everything we do, all aspects of career, of research, we do it with the hope that it will help or contribute. But, things happen all the time, trials shut down overnight, etc. So I use really that motto to help me get through when times are going tough.
What's one small action trainees can take this week to protect their well being?
One of my former mentors advised me about the importance of gratitude and saying thanks. I think in the health system, we're very good at raising problems when they arise, but when things go well, we're not so good at thanking or, expressing our gratitude. So I think it's really, a very cheap, free, easy, quick thing that we can all do is to thank each other when, a colleague thinks of getting you a coffee, when someone does, their handover very well, when a peer covers your clinic when you're away and does a great job, and patients, pass on that, positive feedback. I always make an effort to, pass that on.
Who is the next person you hope to open a door for?
Well, it's hard to single it down to one person, but certainly I think some of the fellows that I'm working with, very grateful for their trust in us, in choosing to work with us, and we don't take that decision lightly. It's certainly a very stressful job learning early phase trials, so we're really hoping, really now is about halfway into their training year, and hoping to help them decide, where they want to go next in terms of career, in terms of research or clinical position.
What should senior consultants do to better support the next generation as you do, Jenny?
I think embrace mentorship really, and role model that, openness and willingness to share their experience to help others.
And if you could change one single thing in oncology training today, what would it be?
I think the communications aspect of training could really be improved. I'm not sure how things are over in Europe, but certainly in Australia and our own oncology training program, communication skills is not taught very extensively, but the feedback we're getting from patients increasingly is the importance of communication. It's such a critical skill and something that does take quite some time to master. And the way that we talk about complex things as NGS, next generation sequencing, artificial intelligence, data, clinical trials, survivorship, all these really complex topics become bread and butter in oncology. I think the language of translating some of the evidence into things that patients can, and their families can understand and comprehend, to ensure that we're able to provide person-centered care, I think is really important.
Fully agree. I think communication skills should be taught in an early stage of the career, and we should also reinforcing during our careers. Dr. Jenny Lou, thank you so much for sharing your time, insights, and care. Your work is opening doors, literally and figuratively, for a healthier oncology workforce.
Thanks so much, Wilma and Ioanna. It's been great being on the podcast, and I'm glad to be able to contribute to spreading the message.
Thank you, Jenny. On my part, burnout may be widespread, but it isn't inevitable. So if you're struggling with burnout or feeling overwhelmed in your career, just reach out. You need to talk about these things.
Find a mentor. Be a mentor. With the right support, mentorship, connection, and a culture of care, we can make oncology a sustainable, fulfilling career path.
And to whoever is listening to our podcast, keep opening doors, open doors for yourselves and for others. This is Dr. Ioanna Nixon.
This is Dr. Vilma Pacheco-Barcia from Open Doors Podcast.
And remember, you belong in the room.
You belong in the room.